Hello, in this video I will be demonstrating some pregnancy massage techniques for the hip and legs. As pregnancy progresses and the hormone relaxin becomes more prevalent, women's hips and legs can often become more sore and sensitive as their bodies prepare for delivery. When performed by a trained professional, the following massage techniques can bring some much needed relief. Starting off today's routine and demonstration with the client in a side-lying position, it is always important to warm up the area first. And for a pregnant client, I'll be using some varying techniques, mainly myofascial, long, gentle strokes, some compressions, and some lymphatic drainage as well to treat the leg and hips. Now, this is important to note for this video that there are concerns when it comes to working on pregnant ladies' legs, lower legs, and feet specifically. These concerns appear to stem from the presence of acupressure and acupuncture points on the feet and ankles, which are said to stimulate the uterus into contraction or possible preterm labor. The points are areas around the ankles, specifically SP6 acupressure point, which is located about 4 fingers above the tip of the medial malleolus. Urinary bladder 60 located between the Achilles tendon and the heel, and urinary bladder 67 on the lateral side of the baby toe or pinky toe. The fear of causing harm to pregnant women sadly does them a real disservice due to many practitioners choosing to avoid the area altogether. One of the most common complaints of pregnancy is water retention, specifically swollen feet and legs. And as massage therapists, we have an excellent skill set to help with this type of edema. But what about those acupressure and acupuncture points, some might ask? And I'm not here to judge the efficacy of acupressure and acupuncture and its ability to assist in naturally inducing labor. But it is clear that the techniques that they do use to manually stimulate these points, namely being very specific firm pressure with a finger or tool in a circular or up and down movement for several minutes at a time, they really bear no relation to lymphatic drainage protocol and gentle massage that is generally recommended and beneficial for healthy pregnant women. Additionally, I do have 4 children, all born with assistance of midwives at home, and what I can tell you is that as the natural birth world and the practitioners that I've worked with, they have toolkits to try to help labor along once you're past due. Massaging the feet, definitely not one of them. And finally, my argument is this: if it were a proven fact that we could induce labor by massaging these areas, I promise you that we would all be extremely busy with lines out the door of women ready to be induced with money in hand. Well, back to the techniques. This is a finger lace compression along the hamstrings and quads. This is a nice way I find to get some good hamstring compression inside line. Transitioning to the hips here, it's important to work the hips just gently. Some women are more sensitive than others in this area, and so just be mindful of that. But working around the sacrum, the greater trochanter, the piriformis, all of the glutes and hip muscles. Nice and gentle compressions. Now beginning the leg work, the client is now in a seated position on a wedge pillow with a bolster underneath the knees. And then this is just going to be a gentle flow, nice gentle strokes, broad palm, working the IT band, the quads, and now some gentle petrissage just for blood flow. Women's bodies are amazing as they carry their children, and a lot of changes occur, and so the legs, the hips can just take a beating, and this kind of work is able to bring a lot of relief. Remember not to forget about the knee. Sometimes we skip over the knees. And now in the lower leg, it really is gentle, long, slow myofascial type techniques, lymphatic drainage techniques. Lymphatic drainage just means that you're going to be slower on your strokes and you are finishing all the way up to the lymph nodes behind the back of the knee, the popliteal fossa. And so as you do your strokes, make sure that they're long and intentional, and that in between some of your specific work, you make sure you head all the way back up to flushing out towards those lymph nodes. And these kinds of strokes can be very effective for edema buildup in the lower leg, ankles, and feet. Again, always heading all the way to the end towards the lymph nodes behind the knee. And as we wrap this up, I just encourage you to gently work these areas without fear, and make sure that pregnant women get the assistance and relief that they deserve in the ankles and lower legs. As always, thank you so much for watching today. And I know it's a bit of a controversial topic, but if you have any questions, go ahead and leave those in the comments down below and I'll do my best to answer them. Thank you so much for watching today. This video is part of my pregnancy massage series, so if you found this content valuable, consider subscribing today. Also, I'd love to hear from you, so make sure you leave any questions you have in the comments down below. Stay healthy, stay strong, and I'll see you next time.